been prescribed to take HCG by your healthcare provider, you should have been told a specific time to take this medicine because this does the final maturation of your eggs to prepare them for either ovulation or egg retrieval. It's actually quite simple to do this. There are a couple of routes of administration you can do this. Your healthcare provider will tell you whether or not to take this injection directly in the muscle or just into subcutaneous fat. So we'll go through both those ways. If you've been prescribed to take this medicine just subcutaneously, then that should be given in the area beneath your belly button and out to the side or in your outer thigh. To do that, you just bunch up a little bit of tissue and put the needle straight in. If you've been prescribed to take this medication intramuscularly, it should go in the muscle of your hip. To do this, just put your hand on your hip bone, and way up in the upper outer quadrant is where you'll give this injection. And you can see in this picture, it's the upper outer quadrant. Your nurse or healthcare provider will be happy to point out exactly where you should give this medication and whether you should take it intramuscularly or subcutaneously. To mix the medication, it's actually quite simple. You'll need the contents of the box of the HCG, which will have a vial that has liquid and a vial that has a little bit of powder in there. It may actually look like a little cake. Next, you'll need a syringe to mix the medication and to draw it up for injection. Start by removing the cap from each bottle, just by lifting it up. The powder and the liquid, just lifting it up to remove it. Next, open this package that has the syringe and the attached needle. And then remove the top from the needle, just by pulling it straight off. Next, take the tip of the needle and insert it into the middle of the rubber part of the vial. You'll want to be able to see the needle in the liquid. Although there are 10 cc's of liquid in the bottle, you're really only going to need about 1 cc. The exact amount of liquid doesn't really matter. The liquid is simply to dissolve the powder. I generally tell patients to withdraw 1 cc. And you do that by just gently pulling back, making sure that the needle can be seen in the liquid. If you have a little air in there, that's okay. Then take it out. Just push straight up to make any air bubbles come out. And then take the bottle of powder and insert the needle into the same place at the top of the vial. Push in all of the liquid, and the powder should dissolve pretty instantly. If necessary, you can just swirl it around a little bit and it dissolves very quickly. Then turn the vial upside down, again making sure you can see the tip of the needle in the fluid, and withdraw all of that mixture. And remove the needle from the vial. If you've been told to take this medication intramuscularly, it's ready to give. The needle's already on. You just simply need to choose your injection site. If it's going to go in the muscle, it'll be this needle. You separate the tissue so that it'll go deep into the muscle. One wipe with alcohol, and then put the needle straight in all the way. Pull back on the plunger just a little bit. You're probably going to get a little bit of air back. That's completely normal. If you get blood, just pull back just a tiny bit on the needle and go ahead and push the medication in. And then pull the needle out straight, all the way out. If you have a little drop of fluid or a little drop of blood, that's completely normal. Just wipe it with an alcohol pad and you can apply a bandage if necessary. Then you can carefully recap the needle, remove it, and place it into a sharps container just to avoid any injury later on. If the medication has been prescribed for you to take subcutaneously, choose the injection site and change and put on one of the smaller needles that will be prescribed that will be sent to you with your medications. The needle will just similarly screw right on the tip of the syringe. Choose your injection site, Wipe it just once with a little bit of alcohol, bunch up the tissue, and take the needle, put it straight in all the way, inject the medicine, release the plunger, pull it straight back all the way. Recap the needle and place the needle and syringe directly into your sharps container. Congratulations, you've now reconstituted and administered your HCG injection.